Hey, welcome back to Grounded, the podcast by Inspiring Time. I'm Amber, and I am the founder of this fun little endeavor here. And joining me today is a sweet friend, Megan Furman. And give me just a second, and we're going to touch on just a few quick housekeeping rules, tips, tricks, all the fun things, and then we're going to dive right into it. If you have not subscribed to the YouTube channel, or if you're listening on a podcast, then please hit the bell, hit the subscribe, do all the fun things. It just helps me know who's listening and what content really speaks to you and keeps you entertained, because that's what we're here for, is mostly entertainment purposes. All right, guys, after you do that, if you want to leave a review, that's also much appreciated. If you cannot find exactly what you're looking for right here on the notes, head over to the blog at Inspiring Time, like the herb, THYME.com. And I am sure you can find a plethora of things that will keep you entertained. All right, now, Megan Furman and I met in 2018. The boys were doing training, and I was the mother to the group. Christopher was really more like the father, and all these amazing couples came into our lives, and single men, but the couples we really connected with. And Megan shared with me, it was so funny. I'm going to share a quick story, and then I'm going to actually introduce her. Looked at Christopher Jr. and goes, "Say that again." And she got really close to his face, and I was like, she's a speech therapist.
No,
it was not really quite like that, but it was very interesting to hear her spin after we'd already been seeing, we'd seen actually two different speech therapists at that point. So being the mom that I am, I always was collecting information from different therapists, trying to help Christopher as we moved, Christopher Jr., as we moved from place to place. Christopher Sr. can speak just fine. Everybody can hear him. He has a deep voice. So Megan, I would love, number one, thank you for being here. You have survived school today.
Thank you for
having I just appreciate you jumping on and hanging out with me for a little bit. Now, I'm going to let you tell us where you're from, a little bit of the background that you want to share with us, and then what your education and how long that took and all those fun things. So take it away.
Fantastic. I am originally from the Seattle, Washington area, and I went to school at the University of Wyoming. Just so happened that UW is about a 4-hour drive from USAFA. So that was very helpful with Jimmy and I, my husband. But yes, I went to school at the University of Wyoming. I did my undergrad in 3 years in communication disorders, and then I got my master's degree there. Takes usually about 2 years. That's what it took for me for the master's program, and then also externships.
So that is quite extensive. And you did it. A lot of times people will go back for their master's, but you decided to like plow through and do it all at one time.
Yeah, I did. I went into school thinking, my mom's a nurse, so I was thinking, okay, maybe I want to do something in healthcare. I also kind of wanted to be a teacher, but it wasn't, neither of those were the exact fit. And it just so happened that speech therapy was a perfect combination of the two. It was a combination of that it can be that healthcare element with the anatomy and physiology of speech and swallowing, and also the teaching aspect of teaching children, adults about the mechanism and how it works. So it was a great combo of those two.
I think that's so interesting. Just for me personally, I went to school. I had no idea what I wanted to be when I grew up. Like if you'd asked me when I was little, I said, I just want to be a mom. I want to be a mom. Perfect. Check. I'm a mom. However, when I get to the, like I'm graduating high school, my mom and sister are both like, no, seriously, what are you going to college for? And I'm like, I don't know. I'll figure it out. And they were actually the ones who
Yep.
said, you love the outdoors, you love gardening, you're amazing at lists. Why don't you like do something in the event planning floral world? And I was like, that sounds fantastic. Thank you for deciding for me. Perfect.
Yes.
Come to find out,
Love it.
when you go to school, it is very interesting. It just takes a little bit of time to figure out what is the perfect fit. And y'all, let me tell you, this is like literally the perfect fit for Megan. She is so good at what she does. I love watching her in action.
It's a lot of fun. I've been enjoying it.
Now, where did
Thank you.
marriage fit into this? So you made it through school, master's degree, and then what?
Well, funny story. I got my master's degree, so my master's of science, and then 4 days later, I was married. So going into
Welcome to the
my
military.
master's degree, yes, I was dating my now husband before I started my master's degree. And my parents had told me beforehand, we really want you to just bust it out, finish it before getting married. And I said, I totally agree. I just want to get it done so I can go on and do great things. And so that's how I made it work. I got my master's degree, and then exactly like, I think it was 7 days later, we got married. So
And you actually, you came in a little bit after he got started, right? Like you made it, you were just finishing school, right?
Yes.
And y'all got
Yes.
married in latter part of the year. Okay.
Yep.
Don't worry, you didn't miss anything in Columbus at that point. You're fine. It's totally fine.
Perfect. I was really excited to get there. That's for
Well, that's the fun part. When you get married, like all the new fun things, and you just want to be right there in the thick and thin of it. But you made it to Columbus, so school's done, this whole new journey of marriage, and now you're trying to find a job. Had you already set up a job? Did you know that you were going to be able to find employment when you got to Columbus?
So how our master's degree works, going back just a little bit, is it's 2 years mostly of just clinicals and school, like the nitty gritty books and tests. And then we also have externships. So our externships you have 2 of them, and they're 3 months long. One's a school-based externship, and then one's a medical-based externship. So Jimmy and I got married after the book portions, the test portions were done, and then I was married during my externship portion. So I had an externship. I didn't know I would have the externship until literally the day before we got married.
Oh,
So I graduated. The day before the wedding, I found out that there was a speech therapist who would be able to basically sponsor me and be my eyes and ears and my go-to in Columbus for my externship period. So then after we got married, then I moved to Columbus for those 3 months. I did my externship, and then I moved to Colorado with my husband's parents and did my medical externship. And then I was able to come all the way back to Columbus and live with him full time, work as a school speech language pathologist.
I guess I missed that part of you not being around. Y'all, if you've never gone through a military training, it's kind of hairy and things are just flying against the wall.
Yeah.
And
it's crazy.
Then add kids into the mix of that, and it's really nutty. So
I don't know how you did it. Oh my gosh.
Well, thank goodness Christopher Sr. is very good at what he does, and he took care of that, and I took care of the rest of it. So it worked out all right. We made it through.
Perfect. Love it.
Now, how easy is it? So y'all are going to continue moving, but first station is what, 4 years? Are y'all there for 4 years?
They tell us around 3, but we don't really know. It's one of those like question marks.
Right?
um,
All, that's how it's going to be forever. So yes,
yeah,
question mark. Okay. But
yep.
when you what was the process then for you transferring? Is it like like somebody in the medical field, like in a hospital where everything has to transfer to the state, or how does that work?
It was really pretty tricky to figure out the first time because nobody sets a yellow brick road to follow, right? So in Columbus, I worked as a school SLP, and that wasn't necessarily exactly what I wanted to do. I wanted to work more in the medical setting. That's more my niche. That's what I love. Even though I really did enjoy the school setting, there's just something about being in that medical atmosphere and the different disorders that you get to see in the hospital and medical setting. So in Columbus, I was a school SLP, and now I am working in assisted living facility. So I am working in more with more of the geriatric population.
Youth to geriatrics. Okay.
Yeah. Yes. Speech language pathology is it's the whole life cycle. You can start at literally 0 year, like 0 infant, with the feeding and swallowing of like a baby in the NICU, to geriatrics where you're 100 and whatever years old and you need cognitive stimulation, you need help swallowing.
Almost cycles back.
Yes, exactly.
Yep.
Yes. So there's for different states, they require different things. So sometimes they may require some sort of like a teaching license to work in the schools, or more of a medical license to work in a medical facility or atmosphere. So it really just depends state to state.
So let's talk, since April is the month of the military child, and I'm not just honing in on military children. This is all children, young and old. What are, because aren't we all children at heart, really?
Yes.
I would say living through UPT and watching the young guys go through that class, I would say they are all still very much children.
Yes.
And I mean that in a very nice way.
Yes. No, Amber, we found a airsoft, or not airsoft gun pellet, but the
Nerf gun
gun in our car a week ago from your son's birthday party. What, 2 years ago? Yes, well, they were all.
I digress a second, because this was hysterical. Junior had not met, well, he had lots of friends on the football team, but he wanted his brothers. So most of the guys going through UPT are 22. When we went through, we were 36. There's a bit of an age difference. But Junior decided he was inviting all of his brothers from class over. So they had a full-on Nerf gun war. And I think the 22-year-olds might have had, or 22 around that age, might have had more fun actually than the younger kids did.
It was a highlight, complete highlight of all of UPT, hands down. It was the best.
So funny. Oh my goodness. Well, okay, so let's talk about kids. And if you're looking, I know with Christopher Jr., we noticed he was a NICU baby. He'd been intubated several times. There were already several telling signs that doctors had said, these are things you need to watch out for. Now, if you were just normal born, no NICU stays or anything like that, what are some of the signs that you might start watching for if you feel like they're not doing correct speech patterns?
Yeah. So as I said before, we serve the whole population. So we have early intervention, which is considered 0 to about 5 years old. So before school, and then elementary, middle school, high school, and so on. So there are different benchmarks throughout the lifespan that you would consider at different ages and for different genders and for different cultures, everything.
Wow.
So there's not really just like one thing that I can tell you to look for,
Right.
but I would say that for a kiddo who's between the ages of 0 through 5, a big thing that we see, and even beyond in elementary school, is if they are not speaking or using their words to express themselves, or if you can understand them, but nobody else around you can understand that child. We have parents come to us a lot with that, saying, well, I know exactly what they're saying. Yeah, you do, because you're their mother or you're their father or guardian, but somebody else may not be able to understand them and their speech, right? So that's a big one for the younger kids. For the older kids, you would look more into receptive language, expressive language, and also the social aspects. And what I mean by that is receptively, if you are asking your child questions like, oh, who did you play with on the playground today? And they answer, oh, we were in school, and they're not answering the question correctly. You asked who, and they answered when or where. Also receptively following directions. If you tell them to do, I need you to open your book, turn the page, get to page 83, and then highlight 3 main words. That's 4 sets of directions. And if they're able to follow those things, they may be stuck on the first one and not being able to receptively understand what they need to do. So that would be receptive language. Expressive language would be more things that you would probably think of in speech therapy, like stuttering or disfluencies in speech, sounds, different sounds that are being pronounced incorrectly, like wabbit instead of rabbit.
Maybe they just watch too many cartoons.
Maybe, who knows? Could also be a lisp. And there's other aspects of communication, because communication is more than just verbal. It's also that nonverbal communication. So knowing how to read people's facial expressions, knowing when they're upset, or being able to put yourself in somebody's shoes and in their situation. So there's one thing, I know that we are labeled as speech language pathologists, speech therapists, but our scope of practice is so much more than just speech.
Yes.
It is
wow.
very broad.
So I remember when Christopher was 2, maybe 3, we were in Ocean Springs at that point. And speaking of other people not understanding what he's saying. Well, number one, I learned as a mother, before we got into speech anything, I learned that big sister has a tendency to speak for little brother.
Yes.
And so instead of encouraging, we all get in a rush as parents, and we would start looking to her to see what he said. And Christopher Senior looks at me and goes, wait a second. I think we've missed a step in here. Like, he needs to be talking. I'm like, yes, this is true. So when we noticed we were saying a lot more, you need to use your words. Let's use your words. They're better than, in a sense, they're better than her words, because she's still putting words literally in your mouth. So we knew then that we were, and again, being a NICU baby, we had heard that, potentially we were a little bit behind on the spectrum of the learning curve, though really for us, it was just in that speech category. It was just verbalizing because he was a very expressive child, fun to be around, but we were very garbled. So by the age of, I guess it started in 2, we were tested for an IEP. What does
Mhm.
that actually stand for? We don't have to really go into terms, but is
Yeah.
that like the first piece of paperwork you need to get speech therapy started, or what does that first step look like?
Yeah, so that first step for the early intervention, they have a different type of IEP or individualized education plan. And it's called a family service plan for the 0 through 5 years old. So before school. But it's a legal binding document. Then when you get into the school setting for elementary school, middle school, etc., then they create what's called an IEP or individualized education plan. So, how that works is either in early intervention, it's usually a parent who is concerned going to a pediatrician and saying, hey, my child isn't speaking as much as his friends, they're about the same age. Should I be concerned? Or my child isn't responding when I'm calling their name. Should I be concerned? The pediatrician would then refer to a speech therapist. For an IEP in the school setting, it's either a parent who brings about concerns or even a teacher, because sometimes a teacher can really see more of those receptive problems better than any other place, because they're asking those who, what, when, where, why questions about verbal information, written information, and they can kind of see if there's something not clicking just right. So then that is when either the parent or the teacher would address a speech therapist, and then the SLP would go in and evaluate the child, and then have a whole big IEP meeting that involves the teacher, the parent, the child, the speech therapist, and an administrator.
I have sat through a lot of IEP meetings.
Yes, so you get it. There's lots of paperwork, lots of legal jargon, but really the main thing about an IEP is for you as a parent to know that you are there to help create the roadmap for your child, to create those goals that can really help them learn and grow in their speech and their language. And then therefore that can help more of their schooling, in their reading, in their writing, just communicating with friends, and many other areas.
I know that Christopher always really enjoyed actually going with the speech therapist because normally all the ones that we had, actually we had one lady probably like closer to retirement, I would say early 60s. He loved her, but that was his very first one. So she was a very larger than life personality, just very hands-on, and he loved this speech therapist. And I remember those first IEPs meetings, I would get a little bit anxious because they would hand you paper after paper after paper and signing. And after the first one, though, I was like, I am ready. I've got my blue pen. I am ready to go. Let's do this thing. And leave it to me, right? Come in with my own blue pen. Even before the pandemic, I
I
was ready.
love it. That's so great. And I would be the speech therapist. I'd be like, oh no, hey, can I borrow that real fast? Thanks.
Oh my goodness. And that's something, again, for my military families listening out there, when you move from system to system, it is now I'm saying this from a parent standpoint, so there is no fallback on Megan here, but from a parent to a parent, when you move from one state to a different state, that is it can be difficult because number one, I had to always carry my IEP notes. This was a little bit before like they were willing to send everything electronically. So I'd have to carry them in my very important paper bag. And then when I got there, I would have to make connections with the speech therapist. They would have to review it. They would have to review him. They would have to evaluate him, and the process would start again. Y'all, he has been in preschool at one school. Nope, at two. Then he went into kindergarten in Georgia. And then he went into first grade in Mississippi. Then we moved second grade. So he was in Arkansas, and now we're here. So that is 6 schools that he has been in with IEPs transferring every time. It can
Wow.
be. Do not let that scare you, because it has made a huge difference. He loves to read now. And I mean, if you've ever met him, the kid is just a cut up. He's so much fun.
I want to say he was like my best friend in Columbus. We had so much fun together.
Ask where Miss Megan was before he would ask where the boys were. He's like, "Where's Miss Megan? Bring her. She's the fun."
Oh, so fun. I do have to say that the transferring of the IEPs, it is frustrating, especially from a parent standpoint, but also you get a lot of different perspectives when you do it that way. We are all trained under the same umbrella, but in so many different ways. So the way that one speech therapist may address a certain issue may be different than somebody else, right? So if Christopher is having a hard time really understanding or it wasn't clicking, but then somebody else could come in there, say it just a little bit differently in a little bit different way, sometimes that can be really helpful for a child.
Oh, I would say we probably plowed through all the different steps and milestones and markers probably more quickly than others because he was excited about going. He got to get out of class. He met a new personality.
Yes.
So he was ready to go. And that just reflects so much on the speech therapists in general because they're giving it their all. So yeah.
Thank you. And it's a little bit easier on our sides because we do get to have these children in a smaller group. So when I worked in the schools, it was either a one-on-one with the kiddo or up to a group of about 3. So it is that one-on-one. They do get that attention, and just that really individualized focus on them and their feelings about their speech and how we can fix that, and that introspective work too. But it's also really fun. We have games, we have toys, all the kit and caboodle. I would say that parents do come to me with the concern that we are taking them out of the classroom setting. So if you have a child who you see for 30 minutes twice a week, that's taking them out of that classroom setting of reading or whatever it may be and bringing them into this speech therapy room. So if that is you and you are concerned about that, I would say just talk to your speech therapist. They usually can be very flexible to figure out and collaborate with the teacher when the best time is for your child to be taken out of the classroom.
And that was never, okay, I won't say never, but it seemed like being in the younger grades at that point, right? We're talking kindergarten, first, second grade. They kind of, the speech therapy really addressed some of the things they were already kind of working on. And
Yes.
when he went back, he felt so much more confident in what he'd learned and the fact that he'd just been given some quiet time where he was getting praise and he felt, okay, I got this. I can go back to the classroom.
Yeah.
I can answer in class and be,
Confident.
Yeah.
Yeah.
So I never noticed that that was a hard, but of course, every child and every personality is very, very different. So just know that sometimes that specialized help really boosts confidence levels, which
Oh, absolutely. Absolutely.
so you've got all these different avenues that you can take that. Once the IEP, that first step is formed, really the speech therapists take it from there. They work one-on-one, they've evaluated, they know what markers they need to hit, and it's really I think Christopher came home with a few bags of fun things at the very beginning, and we would work on some different things, but then I started noticing very quickly that it became very in the moment. They were working, and then what I was reinforcing, S's. Oh, the dreaded S.
Yes.
In fact, I challenge every single one of you all out there to figure out where you're actually supposed to put your tongue when you say a letter, because you're
Yeah.
not going to get it right.
No, if you think about it, it becomes even more frustrating and more difficult. Yes.
So, are there exercises or fun things that any of us could do just to work on using correct language, or if there's an exercise you might want to throw out there that's just kind of fun to do?
Sometimes what I have my parents do for their children who stutter is to try to put themselves into their children's shoes. And what I do is I ask them to not say certain filler words like and every time they do, their child is allowed to scold them for doing that. And it becomes pretty evident pretty fast that it gets really, really annoying, right? To have somebody scolding you for every single time if you do something wrong. So knowing that your child is trying, that they should have a safe space where, like in the speech therapy room, where they're learning and growing. But then also they should be able to have that space where it's just talking to mom. It's okay if I'm telling you about my day and a slushy S slips out, right? Giving them that confidence, and that being comfortable with that is really important.
Oh, I'm just reading a book right now, and it's talking about scaffolding a child. So instead of being the lawnmower parent or the helicopter parent it talks about scaffolding your child, and that really goes into that. You want to be, if they're right here, you want to meet them right here, but you don't want to be right up on them. You want to be away. And letting them know that you're there and present, and it's not a scolding tone. You're asking questions, you're conversating. Of course, that's for younger kids. I understand once they get to teenage years, you just want to probably lock them in a room and throw them some meat or something. I don't know.
I'm sure my mom wanted to do that at some point.
I think all parents will do. Yes, I'm pretty sure of it. So definitely for the younger kids, you just have to meet them. And I would say that's very, very something I try and do often and it's something you have to focus on. And it's just like if they're working on S's, or, they've got a certain exercise that they're working on, good golly, there's no need to beat them over the head with it. Just patience.
Yeah. And most kids know, especially with the sounds that they make, or disfluencies in their speech, like stuttering, they know that they stutter. They know that that sound is wrong. So you really don't have to tell them. They know for a lot. Sometimes they don't. That's a whole different story.
Right.
That's for the therapist to address.
Mhm.
not for somebody who isn't trained directly in it. So be that supportive role, ask your therapist, how can I support my child in this way? What are some good cues that I can use that can carry over in the speech room and outside of the speech room? How much disfluencies or incorrect speech is okay and how much is too much? Just trying to really communicate with your SLP, and they can help you navigate that to the best of their ability.
Go in with I always went in with open hands, open heart, and going, okay, I am here to learn too, because
Yep.
I want to help support what you're doing at home.
Yes.
And please, I made the mistake one time of going to Google to look for things.
Oh my gosh.
Don't do it. There is, especially if you're in the public school realm, and private schools are a little bit different, I'm sure. But public schools have some amazing support systems for speech, especially. Now, other things maybe they lack a little bit more in, but for speech, it seems like everywhere we went, there was somebody there to help. So don't research exercises. Take them directly and get the plan that is specifically for them. And I love that you answered that question with, it's communication, because no one child has the same plan. It's all different.
Yeah. That's why it's an individualized education plan, because it really, really is. And
Yep. I mean, that's all there is. That's it.
yeah.
So if speech is not corrected, let's just say that, you were in an area that didn't have a speech therapist of some sort in the school district. What could that, I mean, are there, other than the obvious of not being able to communicate very well, are there other impediments that might happen along the way?
If your child's speech is not corrected,
Mhm.
how that may
Affect
create
the-
road blocks in the future.
Right.
Okay, so that gets a little bit tricky because it's
Very
always
individual.
yes, very individual, and also education within the non-speech community is growing. So it used to be that many years ago, if somebody had a speech impediment like a stutter, they were seen as not as smart or not able to do certain things. My little brother has a stutter and he is the smartest kid that I know. Graduated with or mechanical engineering, yada yada, right? Just absolutely brilliant. But I think it's really not so much the speech anymore, because people know that everyone has differences in speech. Different accents, different ways that they pronounce things, from Mississippi to New Jersey. It's all different. But it's really that confidence factor that can get kind of bruised and bombarded along the way. So for a child who has had a speech impediment like a stutter, and it just never really got quote unquote fixed, what we try to do is we try to work on that confidence behind it, being able to own up to it. And even before an interview, explaining, hey, I have a stutter. What that means is I may trip over my words a little bit, but I'll be able to get along just fine. But these are my qualifications. Mm-hmm. So it's more the confidence behind the child that you have to build up at that point.
It's and that's why I think it's being a parent, it's hard and it's messy, and sometimes you just look at the situation and go, okay, it's some more paperwork we're dragging along, especially in the military world where we keep moving and things keep moving. But I think from a parent standpoint, making sure you've given it your all to make sure they have the best help and support is, I mean, that's really all that we can do, right? It's just
Yep, absolutely.
so. Oh my goodness. Thank you so much. This has been so much fun. And I've learned several little tips along the way, and I feel like I have been down this road quite a few times. So that I love learning new things. It's fantastic.
Me too. And with each kid, I feel like I'm learning something new all the time. So it's just a constant process. I love it.
Well, and the fact that everybody is very individual and needs are all separate. I mean, you could come up with a million different scenarios, I'm sure. So.
Yeah. Yeah.
Oh goodness. Well, thank you again. Thank you for joining us. I'm so glad we made this happen, and have a great rest of the night.
Thank you.